Okay, so we are at what, May, almost the middle of May?
15th?
We have a great patient who lives in Sarasota during the winter, correct?
Yes.
And North New Jersey in the summer. And she had an interesting situation. How long ago did you have this posterior vitreous detachment?
Last year, January.
Last year, January. And there's a picture here. Is this today's? Oh, that's the residual from today. We really should go back to the beginning of this. But in any case, let me put this on pause. Okay, so we're continuing on. You had a very, very large membrane. It wasn't exactly a floater. It was a membrane, more or less. And the membrane was actually, what was it doing to your vision?
It totally blurred it.
Totally blurred the vision.
I
Well,
think
that's
I had
not...
maybe like, I don't know, less than 50% vision in my left eye.
Yeah. And what it was what we call a thickened hyaloid. And this is the residue of it, which is way out of your visual axis. The original video is somewhere in my fabulous collection of these things. In any case, you were a little skeptical at first, were you not?
Well, I was very distraught that I couldn't see, and the left eye is my better eye. My right eye is not as good as the left one, and I wanted to do whatever is possible, but I didn't really want to go for surgery because I watched something on YouTube and it scared me.
Well, yeah, on vitrectomy surgery, not on what I'm doing, correct?
Well, surgery for floaters.
Well, this is different surgery. This is not a vitrectomy where they put instruments inside the eye and take out the gel entirely. What I do is different than...
Yes,
yeah.
no, but yeah, laser was fine.
Yeah.
But
Yeah. So, but you saw a prominent retina specialist in New
Right.
Jersey.
Yeah.
And was he opposed to doing laser or
Yeah,
skeptical?
he was very skeptical, and he said, we should do it the old-fashioned way and cut and suck it out and
Yeah.
do it that way. But, I was a little bit insistent, and he said, you go ahead, and if you feel you want to do it, go ahead and talk to that guy.
That guy being me,
Being
Dr.
you.
Scott Geller.
Right.
The most experienced of
Uh-huh.
all the guys doing this stuff, and there's only a handful of us. But I felt fairly confident I could do it. I try not to talk a patient into doing something, but instill a little bit of confidence without being over-promising. You never want to over-promise because you never know exactly what the result will be or the patient's reaction. But we had a great result, did we not?
Yeah, absolutely, totally. I mean, when I came home and once the dilation of the iris went back, I sat on my balcony and looked at Sarasota until midnight.
And so it's been a while since you had good vision like that.
Yeah, over a year.
And you actually had, I'd say, 2 or 3 lines improvement on the eye chart. And you noticed that things were clearer, correct?
Definitely. Oh,
And a lot of
difference, total
ophthalmologists don't recognize the fact that sometimes when you have what we call thickened hyaloid, which is the surface of the vitreous gel, that can be a problem. Intermittently, your vision can be perfect, to be 20/20, but if that is in your field of vision, it can deteriorate tremendously. And so what I took an approach of actually splitting the hyaloid, which is unusual in a case like this, but it worked. And you're a happy patient. That's all that counts, right?
Totally, very happy.
So when doctors say, "Well, I want to see a statistical study," I say, "Why don't you just talk to the patient
That's for sure.
and ask them what happened to them?"
Absolutely.
And so
this was a life changer for me again.
you're a happy patient.
Absolutely.
I'm not usually in my own videos, but here I am. There's a great medical student.
You deserve to be in there.
Okay, I try to keep myself out of it. Don't want to get the cult of personality going too much. But you are a great patient, and I'm happy to have done this. It makes me happy to see a good result like this.
I think I'm the really happy one. Thank you very much.
My pleasure.